absolutely. Let's be blunt about this. In a part of the world which is one of the richest part of the world, I think it's absolutely obscene that sick people have to pay to see a doctor, and that they're thinking about introducing charges for sick people to get the medicine that they need. I think that's absolutely outrageous, and straight away those should be two things that we should be saying no to unequivocally. I stood on an election manifesto alongside the other Reform Jersey candidates that said we would support any move towards free GP visits for anyone, at least for the most vulnerable islanders, but preferably anyone, depending on funding and what have you. I was speaking to a GP the other day who said, you know, the state pays a subsidy of around £22 for someone to go see their GP, but if you end up in A&E, it costs around £80 per person. So the obvious thing we want to be doing there is to encourage people to go see their doctor in the early stages of their illness, where in the long run it would be cheaper to sort out their illness, rather than poor people who just can't afford to go see a doctor, waiting and waiting until it's really bad and they just can't handle it anymore, and end up in A&E where they're worse in the long run and their health would have got worse and it will cost more to treat them anyway. So I think it's such a short-sighted way of dealing with things.
But the previous health minister, for 3 years, was looking at all these problems, and came up with no solutions. The current health minister is now looking at them all again. They go through another 3-year term, and they still won't come up with those. Basic answers about a new hospital, yes or no, one piece, two piece. All these basic problems: primary care, A&E, mental health. Every issue has been unresolved through the last ministry.
Well, Mike, that goes back to what Rico said, is that the public, unfortunately, keep electing governments which run round in circles. You know, that's something that I want to see, an overhaul of our political system to stop that from happening in future. I just want to talk about, very briefly, about two people I've spoken to this week, two constituents who are facing a problem with their incapacity benefits, a problem that for each of them is very similar. One of them is lucky in that he has a bit of money, so when I spoke to him on the phone, and I know he's got a meeting with Social Security coming up, I said, right, well, straight away go see a doctor and get a reference. He said, no problem, I'll make sure I do that. Spoke to somebody else who's in exactly the same circumstance. I recommend you go see your doctor before your meeting. I can't afford it. I just don't have the money. So two people in a similar circumstance could end up with different outcomes because one had the money, one didn't. I think that's absolutely perverse, and money should be completely taken out of healthcare. Everyone should get the healthcare they deserve, and that should be top government priority.
Just one thing, and maybe that Sam or others can correct me on this, but my understanding is that if you're below a certain income level, then actually we do get free GP visits. So the idea that people can't go see their GP, I think, may be incorrect. But I certainly accept there's enormous squeeze on Middle England, and I think that when you're at that threshold point, it's very, very difficult. And I think particularly if you have an ongoing illness or a disability, it's very difficult. But I'm not sure the point is right about GP visits and costs.
Well, I mean, some people have different circumstances, but I know that some people actually have a limit on how many free GP visits they can get. So if they've got a period of time where they're particularly ill, towards the end, at least they do have to start paying. And as I said, I've spoken to constituents who are on the breadline, are unable to work because of their health problems, and they just can't afford to see the GP. And that's what they told me, they can't afford it. So some people are having to pay,